have this case for you. It's a made-up case, but it's a concept case. So a 7-year-old boy arrives at the emergency room, accompanied by the parents. The mother states that the child had runny nose and sore throat 4 days ago, but today the child began to feel really sick and running high fever. The client is refusing to take any liquid. So a bunch of words, 5 lines. They give you vitals. Usually you don't see all these things, but you see they give you temperature, blood pressure, heart rate, saturation, and they did exam for you. So you have examination here, drooling, dry mucous memory, inability to open the mouth. And then they ask you a question, what is the most concerning finding? The way this is going to present, you get like about 6 questions on this scenario, and you don't have to memorize it. It will go with you every answer question. This case will be always presented on the left side, so don't worry about it. Before even you start looking at the questions, try to break it down now. You can do the ask, case, buzzwords, read. It's the same thing. You can use it. So what do you need to know? You just break it down. What is the problem? Okay, and you have a 7-year-old, so I will put the ask, case, and buzzwords at the same time. 7-year-old. So you circle the age, arrive in the emergency room accompanied by parents. So that's all. So just a 7-year-old to the emergency room. Okay. The mother stated that the child has been running at runny nose, so some upper respiratory infection and some sore throat for 4 days. 4 days ago, but now he's beginning to feel really sick and he's running high fever. So now he has fever, and the client is refusing and not to take anything. So we have a couple of features, and then we're on the vitals. We have a temperature, blood pressure. Everything looks like it's a little bit, but that is fine. It's 95. It's okay. They did the exams. The kid is drooling. His mucous memory is dry, and then he cannot open his mouth. So you have done your acts, you have had your case, you have done, now we put the buzzwords together. So 7-year-old, okay, 7-year-old went to the emergency room, okay, he had a sore throat, so that's upper respiratory infection. Now he's having fever. It was 4 days ago, right? And on physical exams, we saw drooling, and then inability to open mouth is called trismus. That's what we call trismus. And then evidence of dehydration. So it's a little dehydrated. So that's what we have. Then you figure out, you see 5 lines, I've made it words, and I've break it down. And you ask yourself, you got to make a diagnosis. This is how you can make a diagnosis. 7-year-old with upper respiratory infection, now with fever, is drooling, it's trismus, and dehydrated. That's what I've summarized for that long question. And you have to keep on thinking, what is my differential diagnosis? Is it the kids have rheumatoid fever, scarlet fever? Is it epiglottitis, or is it like tonsillar, peritonsillar abscess? All those things you have to start thinking in your head. So what is the most concerning finding? So with all the symptoms that we have, which one you think? So this is a priority question, you see, but these are you're looking at these things and say, which one is very concerning? Is it the fever that is concerning? And since this is the most concerning information they asking us, we write our B sharp, okay? B sharp means I'm looking for something that will kill the patient. We have fever here, so there's sepsis. Okay, I put sepsis here. Inability to open mouth, that's trismus. Okay, why is the kid cannot open his mouth? It's because of the infection. There's something is causing the mouth not to the muscle going into spasm and it cannot open. So this is also sepsis, but it has progressed into really bad sepsis compared to just having fever. Sore throat, just a irregular sore throat, I'm not worried. Not able to take oral fluid is also worrisome. But among all these three, which one do you think? Based on the B sharp, I'm picking number two because if you're not able to open the mouth, it can develop into airway. You can't breathe, but the airway will be obstructed. So that means there's some infection in the throat such that the kid cannot open. It has spread into the jaw. Fever alone is not enough. There's evidence, physical evidence of something is being compromised. So not being able to open the mouth is more dangerous than just having fever. And it's in the B sharp, it's sepsis, both of them sepsis. So two is the is the um is the right answer. I don't want to give you the diagnosis, but based on this, you can figure out the diagnosis. Okay. The kid has drooling that and say, oh, this is epiglottitis. Look at all the things associated there. Um, um, he, he, the kid has what we call drooling. Don't let that trick you, okay? And think that is epiglottitis because everybody said drilling. It's not drilling alone. Um, Look at the trismus and dehydration. This is peritonsillar abscess because the kid has sore throat 4 days ago. Now he has progressed. Epiglottitis don't do that. It progressed right away. This one, 4 days, then after 4 days. So probably he has a sore throat and then he has developed an abscess. Then that's why he has the trismus. So this is peritonsillar abscess. So let's see the next question. Indicate if the finding is consistent with the diagnosis below. One answer can be applied to both. So now they give you this table, okay? They give you a table, said an expected, or this maybe I can just change this to like diagnosis, okay? This is diagnosis or expected. We can leave it as the way it is, expected. So I'll just clean it. This is the expected finding, and this is the diagnosis. This is another diagnosis. So you take drooling. Can you see drooling in epiglottitis? Yes. Can you see in peritonsillar abscess? Yes. Muffled voiced. This is what happened. They develop what we call a potato, hot potato voice. And that is common with the peritonsillar abscess. Does it happen in epiglottitis? Yes, they develop dysphonia. They can, and they sound really horrible. It's the same thing. So they all have like a muffled voice. Tripod position. Who usually stay in the tripod position to open the airway is epiglottitis. But these guys don't do that. Deviation of the uvula. Yeah, where the tonsil is, if there's infection, the uvula will deviate. It doesn't occur in epiglottitis, it occur in a peritonsillar abscess. Trismus, like I said, the jaw cannot open, your mouth cannot open, and that occur in peritonsillar abscess. Dysphonia is almost the same, close to the muffled sound. It sounds horrible, pain when it's swallowed. That's why the kid doesn't want to eat, drink anything, and that can occur in epiglottitis and peritonsillar abscess. And this is what they will give you for differential diagnosis. You see what I'm doing? So as you learn, that is why you got to come to this channel and learn how to develop pathophysiology. You can't just read. You have to understand each disease process and what is underlying problem so that you can understand what kind of symptoms you will see. And this is the key for the next few years, in which cases, pathophysiology. So you have to understand and differentiate between disease process, epiglottitis, and then peritonsillar. They all have similar features, but you got to find the key features that you'll be able to use to distinguish between them. So that's that question. Then number three, now you make the diagnosis. We already talked about the diagnosis. What is the next priority diagnosis? Based on the things you've seen, it's not this one. This one has 4 Ds. They have drooling, okay? They have dysphonia, okay? They have dysphagia and distressed airway, but they don't have trismus, okay? If this is epiglottitis, that the history will have given you the kid was in the tripod position. Nobody even asked the kid to do that. The kid will do that. So as soon as they present to the emergency room, they will be in that position, and that is your key. So it cannot be this. It's no scarlet fever because the kid doesn't have rash. They don't have rash. Kawasaki, the same thing. There's no rash. Kawasaki, the rash start from the head all the way down, and they don't present like that. And so the right answer is peritonsillar abscess. That means they develop a tonsil pharyngitis. Now they have developed infection near the tonsil. So and then something has to be done about it. And then the last one, so the client underwent elective surgery 3 months later due to recurrent upper respiratory infection. So you keep on having sore throat because of the tonsil. So the kid underwent surgery. Which of the following teaching is appropriate? So then you ask yourself, you see, is there something they will ask you in the old this thing? Oh, they will tell you the patient had tonsillectomy. Therefore, what do you do? What kind of teaching? It's the same thing, but presented in different way. Patient underwent surgery, and that surgery should be tonsillectomy. Okay. Um, they won't tell you, but you have to figure out. When tonsillectomy, what kind of teaching do you provide after tonsillectomy? Remember, the tonsil is a vascular organ, so it bleeds. It bleeds. It bleeds a lot. So we don't want bleeding. So it's a vascular organ. And it bleeds a lot. So the after surgery, the most important is bleeding precaution. Okay. So all the things you tell the mother is to prevent bleeding as much as possible. And how do you do that? They shouldn't have any contact sports for 14 days. They should not clear their throat. If the kid is swallowing too much, it may be blood, okay? So if they swallow too much, yeah, if they keep on swallowing too much, um, and that means they're bleeding, okay? And then you tell them not to gargle, okay? Don't gargle. And you can't do that. When you do that, then you're going to bleed because you take away the clot, okay? Um, And so those are the features that you have to know. No contact sports, and those are the teaching we provide. But this is provided in a different way. The other thing too is they can tell you the kid present 3 months late after the tonsillectomy, and his blood pressure is low, his heart rate is high, urine output is low. That is all bleeding. So they can present it in different forms. So then based on the content we've had, and this is the way I do it in my SATA. So you read the last question, find the being asked, find the case, find the the buzzwords, and then put them together, and then select an answer and move on. Don't never compare. So we're going to select an answer. So is asked. So the strategy is what is being asked. What is being asked, okay, that's teaching. Then case, patient had a tonsillectomy. Buzzwords is what? Teaching, okay, after tonsillectomy. Then rewrite, teaching after tonsillectomy. And this is where you bring your content. So I brought my content here. Then you go and make a choice based on your content. I'm taking this content with me. It's like a toolbox. I take it with me, and then I'm looking, checking. Every time I look at an answer, is it in my toolbox? If it's in my toolbox, I'm picking it. Avoid clearing of throat. Oh, is it my toolbox? So that is good. This teaching is appropriate. No contact sports for 7 days. Well, it's partially in my listing. It's not 7 days, it's 14 days. This is inappropriate. Call with excessive swallowing. Yes, I'm calling. No gargling until told by the ACP. Perfect. So, and that's what you provided. And that's the way the cases will be presented You guys know it. If you've been in this channel, you well invest with this knowledge, uh, and I know you can do good. Um, Take care of yourself. Come back for more and subscribe and tell your friends about this channel so that we can improve it. Comment is well appreciated. Thank you very much and take care of yourself.